Welcome to a deep dive into the brilliance of homeopathy. In this video, we'll explore how homeopathy stands apart from conventional medicine, focusing on the whole person rather than just the disease. Drawing from real-life experiences in a busy trauma center, we'll uncover why homeopathy offers a unique perspective on healing. Whether you're new to the concept or have heard about it before, this journey will help you understand the core principles and real-world impact of treating the patient as a whole. Let's begin by setting the stage with a look at the medical environment where these ideas took root. During my residency at Highland Hospital in Oakland, California, I worked in a trauma center serving a diverse inner-city population. This intense environment provided invaluable experience in emergencies, trauma, and intensive care. However, it also highlighted the stark differences between conventional and homeopathic approaches. While I gained confidence in handling critical situations, I noticed that my background in naturopathy was often misunderstood or dismissed by colleagues. This experience set the stage for a deeper exploration of how homeopathy views illness and healing. As my training progressed, the differences between conventional and homeopathic medicine became increasingly clear. Conventional medicine seeks similarities among patients, applying standardized treatments to diagnose diseases. In contrast, homeopathy searches for what makes each person unique, aiming to treat the individual rather than just the disease. This fundamental distinction shapes every aspect of diagnosis and care, influencing how practitioners view symptoms and healing. Homeopathy is rooted in the idea that disease affects the entire person, not just a specific organ or system. When a person falls ill, it is their whole being that responds to both the illness and the treatment. This holistic perspective means that every symptom, no matter how minor, is considered valuable information. By looking at the totality of symptoms, homeopaths aim to understand the unique way each individual experiences disease. To truly appreciate how homeopathy differs from conventional medicine, we must look closely at symptoms. In homeopathy, symptoms are the key to understanding the whole person. Unlike conventional medicine, which often focuses only on symptoms that point to a specific disease, homeopathy values every sign and sensation the patient experiences. This approach is as fundamentally different as viewing the earth as round instead of flat. When someone becomes ill, conventional medicine pays attention mainly to symptoms that help identify the disease. For example, a patient with asthma will be evaluated for shortness of breath, wheezing, and abnormal breathing tests. These disease symptoms are similar across patients and guide the diagnosis and treatment. However, this approach often overlooks the broader picture of how the disease affects the individual as a whole. Once a disease is diagnosed, conventional medicine typically applies the same treatment to all patients with that condition. For instance, nearly all asthmatics receive similar medications and care plans. While this method is efficient for managing diseases, it often fails to address the unique ways individuals experience and respond to illness. The signs and symptoms used for diagnosis are rarely useful for tailoring treatment to the whole person. Homeopathy, on the other hand, pays close attention to the unique symptoms that conventional medicine often ignores. These individual responses to disease, such as what triggers or relieves symptoms, personal cravings, emotional states, and time patterns, paint a complete picture of the patient. By considering these details, homeopaths can better understand how the whole person is affected and select a remedy that matches their unique experience. Let's revisit asthma as an example. While conventional medicine treats all asthmatics similarly, homeopathy recognizes that each person's experience is different. One patient's shortness of breath may worsen in open air, while another finds relief outdoors. Some crave cold drinks, others have no thirst. Emotional states, time of day, and even cravings for certain foods can all vary. These differences are crucial in homeopathic assessment and treatment. In homeopathy, The sum of all a patient's symptoms, physical, emotional, and mental, forms the basis for treatment. This totality reflects the individual's unique response to disease and is essential for selecting the right remedy. By gathering a comprehensive symptom picture, homeopaths can address the root of the illness, not just its outward manifestations. Conventional medicine often ignores the totality of a patient's symptoms because it lacks the tools to utilize this information. Its focus is on treating the disease, not the person. As a result, many symptoms that could provide valuable insight into the patient's overall health are left unaddressed. Homeopathy, however, sees these symptoms as vital clues to understanding and healing the whole person. Conventional medicines are designed to produce specific effects in the body, but they often cause additional, unwanted effects known as side effects. These side effects are simply other actions of the medicine on the body, not separate phenomena. The term side effect is a way to downplay the unintended consequences of drug therapy, but in reality, all effects are part of the medicine's action. A closer look reveals that there is no such thing as a true side effect, only effects that are either desired or undesired. This perspective challenges the conventional view and highlights the importance of considering all the ways a medicine can impact the body. Homeopathy recognizes the full spectrum of a medicine's effects, using this knowledge to match remedies to patients more precisely. Homeopathy takes a fundamentally different approach by recognizing all effects of a medicine, not dividing them into effects and side effects. The basic principle, like cures like, means that a medicine can cure symptoms it is capable of causing. The goal is to match the patient's unique symptom profile with a remedy that produces similar effects, leading to true healing without forcing unwanted reactions. At the heart of homeopathy is the principle that like cures like. This means that a substance capable of causing certain symptoms in a healthy person can be used to treat similar symptoms in a sick person. By carefully matching the remedy to the patient's total symptom picture, homeopathy aims to stimulate the body's natural healing response using minimal, non-toxic doses. In homeopathy, the remedy is prescribed for the patient, not just the disease. This means that the practitioner looks at the entire constellation of symptoms, physical, emotional, and mental, to find the best match. When the right remedy is chosen, it can be given in a tiny, non-toxic dose, avoiding the side effects commonly seen with conventional drugs. Because homeopathic remedies are matched to the patient's unique symptom profile and given in very small doses, they do not force their effects on the body. This approach eliminates the risk of side effects, making homeopathy a gentle and safe form of treatment when properly prescribed. This is the true genius of homeopathy. Focusing on the patient as a whole. Conventional medicine often treats diseases as isolated entities, but homeopathy recognizes that it is the person who is ill and who must be healed. By addressing the entire individual, homeopathy aims for a deeper, more lasting recovery. The difference between homeopathy and conventional medicine is as fundamental as the difference between believing the earth is flat versus round. Conventional medicine sees only part of the reality, treating diseases as separate from the person. Homeopathy, like recognizing the earth is round, sees the bigger picture and treats the patient as an integrated whole. Homeopathic practitioners aim to prescribe a single, similar remedy that matches the patient's entire health picture. When the right remedy is chosen, improvement is seen across all symptoms, including those associated with the diagnosed disease. This unified approach leads to natural recovery as the patient's overall health improves. Let's look at a real-life example. A 40-year-old woman returned for her follow-up visit, amazed that her lifelong skin rash had completely disappeared. Interestingly, she hadn't even mentioned the rash during her initial appointment, as she was so accustomed to it. Yet, After receiving a homeopathic remedy tailored to her whole symptom picture, not only did her main complaints improve, but so did the rash she'd forgotten to mention. This case illustrates the power of treating the whole person. Even symptoms that were not discussed or considered important by the patient can improve when the underlying imbalance is addressed. Homeopathy's holistic approach ensures that healing is not limited to the most obvious complaints, but extends to all aspects of health. For homeopaths, the challenge is to gather a complete picture of the patient's health, including symptoms that may seem unrelated or insignificant. By listening carefully and considering the whole person, practitioners can select remedies that promote true healing rather than just suppressing symptoms. Many people equate health with the absence of disease, but true health is much more than that. Healthy individuals not only get sick less often, but also feel better overall. Homeopathy recognizes that simply eliminating a disease does not guarantee a higher state of health. The goal is to enhance the patient's overall well-being, not just remove symptoms. Treating only the disease, as is common in conventional medicine, does not always result in a healthier person. It is possible for the disease to disappear while the patient's overall health remains poor or even worsens. Symptoms like low energy, sleep problems, or emotional imbalance may persist, indicating that the underlying health has not truly improved. In a reduced state of health, patients often experience recurring or new diseases. Conventional medicine may treat each new illness as a separate entity, missing the connection between them. Homeopathy, however, sees these patterns as part of the individual's unique health expression, emphasizing the importance of treating the whole person to break the cycle. The key link between various diseases is the patient themselves. Illnesses do not occur in isolation. They are processes involving the same individual. Homeopathy recognizes that past and present symptoms are interconnected, reflecting the unique health journey of each person. From the homeopathic perspective, all symptoms past and present are related. They provide insight into the individual's overall health and help guide treatment. By understanding these connections, homeopaths can select remedies that address the root causes, leading to more specific and lasting healing. Homeopathy asserts that the body does not heal in isolated parts. Instead, it is the whole person who gets sick and who must recover. Treating only the affected part may not benefit the patient as a whole. True healing involves restoring balance and health to the entire organism. The ultimate proof of homeopathy's effectiveness is a cured patient, someone who has been healed as a whole, not just relieved of specific symptoms. When the right remedy is chosen, improvements are seen across all areas of health, demonstrating the power of treating the individual rather than just the disease. If the patient in our earlier case had been treated conventionally, she would have received separate treatments for each complaint: anti-anxiety medication, cortisone for her hands, and mouthwash for bad breath. Each treatment targets a part, not the whole, and may only control symptoms rather than resolve the underlying imbalance. Using the homeopathic approach, the practitioner finds a remedy that matches the patient's entire health picture. As the patient heals, all problems improve, even those not specifically mentioned. This demonstrates the power of treating the whole person, leading to deeper and more lasting recovery. Conventional treatments often control symptoms, providing temporary relief but not addressing the root cause. Homeopathy, by contrast, seeks to heal the underlying imbalance, resulting in improvements across all symptoms and a higher level of health. True healing cannot be forced. It is a natural process in which the person attains a higher level of health, and the disease resolves as a result. Homeopathy supports this process by stimulating the body's innate healing abilities, rather than suppressing symptoms. Health is not simply the absence of disease, but a dynamic balance. Homeopathy aims to restore this balance by treating the whole person. When balance is achieved, the individual experiences fewer illnesses and greater overall well-being. Symptoms are not just nuisances to be suppressed, they are expressions of the body's attempt to restore balance. Homeopathy interprets these signals as important clues, using them to guide treatment and promote true healing. A skilled homeopath listens deeply, gathering a full picture of the patient's health. By understanding the connections between symptoms and the patient's unique experience, the practitioner can select the most effective remedy. This individualized approach is at the heart of homeopathic success. The most compelling evidence for homeopathy comes from patient stories. When individuals experience broad improvements in health after homeopathic treatment, it demonstrates the effectiveness of treating the whole person. These stories highlight the limitations of conventional approaches and the potential for true healing. Homeopathy's genius lies in its recognition that it is the patient who is ill, not just a collection of symptoms or diseases. By treating the whole person, homeopathy offers a path to deeper, more lasting health. This approach challenges conventional thinking and opens new possibilities for healing. True healing is a process that cannot be forced by external means. Homeopathy supports the body's natural ability to recover, guiding the patient toward a higher level of health. This gentle, individualized approach stands in contrast to the aggressive interventions often seen in conventional medicine. A homeopathic remedy is chosen based on the totality of the patient's symptoms. When the right remedy is found, it acts as a catalyst for healing, helping the body restore balance and resolve disease naturally. This process is safe, effective, and free from the side effects associated with conventional drugs. In summary, homeopathy offers a vision of health that goes beyond the absence of disease. By treating the whole person and recognizing the interconnectedness of all symptoms, homeopathy aims for true healing and lasting well-being. This approach empowers patients to achieve a higher level of health and vitality. Homeopathy challenges us to rethink our approach to health and disease. By focusing on the individual and their unique experience, it opens the door to more personalized and effective care. This new perspective encourages us to see health as a dynamic, holistic process. One of the greatest strengths of homeopathy is its ability to empower patients. By involving them in their own healing process and addressing their unique needs, homeopathy fosters a sense of agency and partnership in health. This empowerment is key to achieving lasting results. In conclusion, the brilliance of homeopathy lies in its holistic, patient-centered approach. By treating the whole person and recognizing the interconnectedness of all symptoms, homeopathy offers a path to true healing and lasting health. Whether you are new to homeopathy or seeking a deeper understanding, this approach invites you to see health in a new light, one where the patient, not just the disease, is at the center of care.